I'm Dr. Kutyabami Paul from the Department of Pharmacy, Makerere University, with the support from the Government of Uganda through the Makerere University Research and Innovation Fund. We conducted a study titled Pharmaceuticals in the Environment, the Emerging Pollutants for Surface Water and Foodstuffs Grown in Wetlands in Kampala City, Uganda. We know that medicines by nature are designed to elicit specific biological activities in a relatively small concentration, and this property is retained when medicines enter the environment. In that regard, they affect non-target organisms either directly or indirectly through the food chain. We know that medicines are very vital in healthcare delivery, making them widely and constantly consumed in large volumes and consequently excreted by both animals and human beings. Excretion and inappropriate handling of medicines along the supply chain, as well as inappropriate disposal, are implicated as the major ways through which medicines can enter the environment. Therefore, sewage plants, shallow pit latrines, medicine factories, health facilities, farms, as well as disposal places are point sources where pharmaceuticals can enter the environment. And these are facilitated by urbanization, population growth, industrialization, as well as poor sanitation, which are rife in Kampala, making Kampala City predisposed to pollution of pharmaceuticals. We were set out to assess presence and levels of selected medicines within the environment, where we looked at surface waters and foodstuffs grown in wetlands in the city, and see how, and also assess factors that may be contributing to pollution with medicines. We conducted a survey of households, key informant interviews from factories making medicines, health units, and farms around Kampala, and later on did laboratory analysis of water samples and foodstuffs grown in wetlands around factories, health facilities, as well as farms to assess the presence of pharmaceuticals. We interviewed 3 key informants and conducted surveys among 540 households in all the divisions of Kampala. We should note that Central Division doesn't have a factory, nor does it have a farm, so all the farms and factories work out of Central Division of Kampala. Our findings mostly had contained pharmaceutical residues, indicating that Kampala is extensively polluted with pharmaceuticals. The levels of medicines in these samples that we got were all above the predicted non-effective concentration, and this is the concentration above which we believe that medicines are likely to cause toxic effect on organisms in the environment, and below which they are unlikely to cause effect on environmental organisms. And we also, more than half of the households that we interviewed had unused medicines and had disposed them in the past, implying that their disposal could as well have ended up in the environment. There was general lack of appropriate knowledge about appropriate handling of medicines, as well as appropriate disposal of medicines within households, and also lack of knowledge about appropriate management of effluent waters at factories and health facilities and farms. The solutions that we proposed regarding environmental pollution of pharmaceuticals institute interventions that can improve knowledge of appropriate handling and disposal of unused medicines within households, and as well as handling of effluent waters at factories, health facilities, and farms. There is need for regular environmental impact assessment focusing on pharmaceuticals among the responsible organizations around factories, farms, and health facilities. We need also to include eco-pharmacovigilance in regulation in the regular pharmacovigilance activities by NDA, and we encourage reverse logistics of unused medicines in households, where households can be able to return unused medicines to where they got them from for proper disposal. As wolf solution, lastly, we need to incorporate training on medicine pollution in the pre and in-service training of health workers at respective institutions. And in terms of impacts on policy and training, we need to incorporate environmental impact assessment in the routine inspection of medicine factories, health facilities, and farms by NEMA, NDA, and KCCA. We need also to incorporate ecopharmacovigilance in the pharmacovigilance activities by NDA. And lastly, we need to, for sustainability, we need to incorporate environmental pollution of pharmaceuticals in the pre and in-service training of health workers at their respective facilities.